Welcome to the Menopause and Cancer podcast, where we speak with cancer patient survivors and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. I'm your host, Dani, and today's episode is a little bit different and honestly, a lot more hands-on than some of our other episodes. I'm joined by a small group from our community for an interactive workshop on sexual health after cancer. This is very much a show and tell session. So we'll be talking about the Genitourinary Syndrome of Menopause, but we will be really discussing the use of dilators, what's different about them. If you were going to purchase them, why would you and why do you need them? Maybe you've been prescribed them by your medical team. We'll be talking about vibrators and also what's the benefit of them, not just for our sexual stimulation, but maybe also for blood flow and other things that they might be helpful for. And just for full transparency, today I've got all sorts of sex toys plugged into my computer. They're on charge at the moment, and I'm hoping to get them springing into action later on in the conversation. I'm absolutely delighted to be joined by Eleanor, our expert speaker from Pelvic Relief, and she's going to guide us through what's happening in the body, why these tools can help, and how to use them safely and confidently. And as always, this space is about normalizing the conversation, reducing fear, and giving you practical options for maybe being a bit more comfortable in using some of these practical strategies. No one size fits all, as always. So here we go. Lots of information, reassurance, and choices. That's what this episode is all about.
So, as Dani said, I'm Eleanor Gardner, but everyone calls me Elle. I am a physiotherapist by training, but I have owned and run a company called Pelvic Relief for the last 10 years now. And so Pelvic Relief was a company that I started because I recognised that there was a gap in the way women's genitourinary and sexual health was treated. And so I wanted to bring together products to support women to manage their genitourinary or sexual health. And the bulk of the customers in our community that come to us have experienced a real change in their gynae or sexual health. And so we do a lot of work with women who have experienced cancer and experienced the changes to their gynae and sexual health that has come as a result of their treatment. But we also work with communities of women who have a really wide range of conditions that affect their pelvic health, whether that's bladder pain or pelvic pain or menopause, or changes postnatally. So the thread that holds all of our community in common, though, is that they are looking for solutions where they haven't necessarily found them. They are looking to understand how to rehabilitate post a change in their gynae or sexual health. So it's the common thread is women. So hopefully today we can talk about lots of different solutions and tools that you can build into your lives to support yourself in this area. Me personally, so I've mentioned my background is physiotherapy, and really the goal is just to improve the conversations around gynae and sexual health and improve care in this area. I have 3 children myself, and the interest in pelvic health in particular came after having 3 children very close together and not getting the care I needed postnatally. I have 2 dogs, and as Dani mentioned, I walked with you last year on a fundraising walk for menopause and cancer. So menopause and cancer is our charity of the year, and again into 2026. And I can highly recommend the walking challenge, as long as you have the right socks. But hopefully it'll be another one we do this year.
We walked, Eleanor, we walked past many men, didn't we? And we
Yes.
educated them on why we walked. They educated them on what charities they walk for. But
Yeah.
the amount of times the word vulva and vagina has been mentioned in our
Yeah.
12 and a half hours walking, I kid you not, guys, it was quite hilarious at points because you could see other groups maybe walking past us suddenly go quiet.
Yeah. Yeah,
With,
yeah,
oh, I think
absolutely.
they're eavesdropping.
Yeah. When I sort of talk about who I am, I should say who I'm not. I'm not a practicing medic. I'm not a doctor. We have medical doctors who sit on our medical advisory board, who advise us on our products, on how they fit into clinical care pathways. We work very closely with the medical community, but everything we talk about today, how we incorporate healthcare into sexual health, these are conversations that I hope we can start. But the overarching message is always to discuss how these products or how this advice fits into your own care with your own doctors. Certainly when it comes to the very specific area of changes as a result of menopause or as a result of the treatment that you're undergoing. So that's something to always keep in mind whenever we're talking about these things. So specifically why we're here and talking about sexual health and changes as a result of cancer treatment is to really discuss the genitourinary syndrome of menopause. So if you've experienced as a result of your treatment that you've gone into menopause, there are many, many, as you know, and as Dani is, and the charity is so good at explaining multiple different symptoms that happens as a result of that change. We are going to be specifically talking about the changes that happen to your gynae, your whole of your pelvic region. So we are talking about GSM. It's a chronic and progressive condition due to estrogen deficiency. And there's a potential negative impact on all of the genital and urinary tissue. So that includes the vulva, the vagina, the bladder, and urethra. So it's really important to know it's not just the vagina we're talking about. We're talking about all of the tissues in that pelvic region. So that is a change that we experience as a result of that loss of estrogen. And it can have sort of wide-ranging impacts. And I promise this bit's a little bit depressing, but it's just important, I thought, to just revisit what those symptoms and physical drivers are, because there might be changes that you've experienced that you haven't necessarily associated. It's not just a bit of dryness. What people in the women can experience a really wide range of symptoms. So vaginal and vulval, not just dryness, it can result in burning, change in discharge, itching, real discomfort. This obviously has a huge impact on sexual health and sexual well-being. So we can experience bleeding after penetration, discomfort, pain during intercourse, reduced lubrication. It can impact smear tests. It can impact arousal, orgasm, desire. And then it's also important to know that we're not just talking about the vagina and vulva. The bladder is highly estrogenized. So we've got lots of estrogen receptors in the bladder and in the urethra, which is the water pipe that goes from the bladder that you wee through. So you can have real changes to your urinary symptoms, frequency, urgency, burning, recurrent UTIs. Women, unfortunately, aren't particularly well designed. So the women's urethra is much shorter than a male's. We can easily get infections, and we can talk about why that changes as a result of GSM, changes to nighttime frequency as well. So the physical drivers of these symptoms as a result of this loss of elasticity, lubrication, loss of rugae, which is the sort of ridged, nice, juicy, plump tissue, we can get shortening, tightening of the vagina. It's all a result of these changes to estrogen level, which underpin these changes, which can cause these symptoms. Now, this is a really depressing start to our chat on a Thursday lunchtime. And I don't want to depress us. What I wanted to do was just draw attention to how wide-ranging these symptoms can be. And not everybody's going to experience all of them, but I think often they're missed. Often we don't realise that those urinary symptoms are part of what we're talking about when we're talking about those changes to our pelvic health. So it might be that just one or two of those ring a bell and you think, oh, actually, I thought I was doing okay, but I'm actually experiencing one or two things on this list. And I think it's also to just underpin that this isn't just a bit of vaginal dryness. This is a really highly impactful syndrome that we need to talk about. We need to talk about with each other. We need to talk about with our healthcare providers, and we need to get ahead of it to try and prevent some of these symptoms getting really severe. So the thing to know, which I've already said, but is to remind us that it's these changes to estrogen that underpins these symptoms. So really explore all options available, the medical options available to you, which I know is complicated, but discussing vaginal estrogen with your medical provider is a really important conversation to have, and that will be important to have with your clinical team, with your doctor. And moving forward, this is a chronic condition that will last. We have to manage through our lives. But let's put that, put that knowledge piece over here. And what we're really here to do today is to explore all the non-hormonal solutions that are out there, to discuss hopefully tips and tricks that we've all learned, because I really believe that knowledge is power, and we need to know what it is we're talking about, but then we need to explore lots of different things, and I'm sure some of them you will have come across, but hopefully some will be new, and so there are some really positive things we can do to support ourselves and spread the word more widely to support other women who are experiencing the same thing. So just a sort of top line checklist, some of the self-care things that we can do before we go into the products, both that I've got here and that Dani has plugged into her computer. Some of the self-care things to manage these vaginal and vulval and bladder changes. So moisturizers and lubricants, we're going to go into in a little bit more detail, but always making sure they're pH balanced to the vagina, and always making sure that they contain ingredients that are really sensitive to gynecological health. And I may tell a little story later to sort of a bit of it's a more fun story than I'm just going to make it sound, but the history of lubricant and moisturizer formulation was not driven by good gynecological health. So hunting out really products that are really good for you is really important. Blood flow to the vagina is really helpful. We know it's helpful with tissue lubrication, with health of those tissues. So sex, masturbation, Kegels is the American term, but the pelvic floor exercises, what you might know as using vibrators, using dilators, can all help with your vaginal health. So there's a really positive reason to try and explore all of these things. Avoiding things that are painful. So this is never about pushing through pain. We don't want those micro tears. We don't want damage. We want to explore other things to get the positive benefits, but we never want sex. We never want any of these rehabilitation tools to be painful. The vagina itself. So when we're talking about the vagina, we're talking about internal. The vulva is all of those external tissues, the labia. So internal, the vagina is self-cleaning. Do not douche. So douching is introducing products inside the vagina to clean or deodorize. We don't want any products that contain perfumes. It is a naturally self-cleaning area of the body. So that's really important. Breathable cotton or bamboo underwear is ideal. I heard a gynecologist recently saying the thong is a string of doom, but it really breathable cotton avoiding tight clothing, changing out of gym wear. What we want to do is encourage good bacteria and try and avoid bad bacteria traveling from the back passage through to the vagina and the urethra. If you're using period pads or pads for, if you've got a little bit of incontinence, cotton and organic is best. We want to avoid the chemicals that are put on some of those plastic pads. And we'll talk about some nice barrier creams. I've got a lovely one that we've started importing from Australia, which is really lovely if you've got some vulval soreness, to try and protect from those micro tears and things. So those are just some sort of top line tips I like to start with.
One of the things that I was just curious about, and because we want to make this really practical, is what worries have people got that are here today? So thank you for letting me butt in. I didn't want to interrupt you, but I wonder if people can just go into the chat. It'll just come to me. It's totally anonymous. And tell us, are you worried you may be experiencing symptoms further down the line and you're here because you just want to sort of skill up? Maybe you've listened to every podcast and other YouTubes we've brought out, but you're still experiencing symptoms and you're here because you've got stuff going on right now. Then what is that? It would be so helpful for us to know. You could just put into the chat box vaginal dryness or pain upon intercourse or bleeding after sex, whatever it is that you're experiencing. If you're happy to share, just tell us. I think it's also really helpful for others in our community to know that they're not alone. Should you be struggling. And I'm going to read out pain on intercourse. Vagina has extremely shrunk, for example. Someone else saying bleeding after intercourse, extreme vaginal dryness, can't sit down, skin tearing on my labia. I love it. Everyone's using really great terminology. Labia. Yeah, it's really good. People saying can't shift the thrush. So that's really interesting. No desire at all for anything sexual, going to get vaginal estrogen. So there is stuff coming in and you can see how broad it is, isn't it? It's from physical, real pain and discomfort all the way to almost psychosexual, emotional, not having desire. So it's a really difficult topic. We've also got vaginal estrogen. Sorry, what was that? Vaginal estrogen, how long can I take it for safely? Oncologist has limited it to 2 weeks per year. We won't be able to answer all of the questions, but we can talk about it today. No desire and extreme discomfort, body consciousness and anxiety. So lots coming up. Not sure which vaginal moisturizer to use. So confusion over products, lack of libido. So it's a really broad umbrella term. Is this what you see when people come and maybe inquire about how you can help them?
This is exactly what we see. I think what's really difficult to navigate is it is a very individual journey for, I mean, that does sound a little bit cheesy, but everybody is different. And when I put that slide up to talk about all of those different symptoms, when we think about menopause more broadly, and especially the sort of severe menopause that happens as a result of cancer treatment, you can have a slide with it feels like there's a million different things you can experience. And that's, when we're looking at the whole body. And then when we're looking at GSM and sex, we could have another million words up there, and everybody will experience that differently. When I think of with our gynae health and sex, what was really apparent to me 10 years ago was the way that we talked about gynae and sexual health in the UK was that the gynecologist dealt with gynae health, and then the sexual health clinic was the clinic round the back of the hospital, and nobody really joined up the two. Whereas for me, there is no, it is all part of one story. If you are struggling with pain, with dryness, with recurrent thrush, with BV, with changes in smell, with that shrinking of the tissue, any of those things are going to highly impact your sex life. If you've had a complete body image change as a result of treatment, you might have had mastectomy, that will impact your sex life. So it is completely circular, this the physical changes you experience, how you feel about sex, and then whether sex is enjoyable, and that circle continues. we'll talk about some of the practical things today. I do a lot of events that I go to. We have really amazing psychosexual therapists, and I'm sure you work with some really good ones within the charity. And a lot of the tips I give are often from that group of healthcare professionals. And I think that it's really, if you haven't been offered psychosexual therapy as part of your, some NHS trusts have psychosexual therapists built into the care pathway, others don't at all. That's something that's really worth exploring at some point on your treatment and your rehabilitation, and when you feel ready to explore that.
Yeah.
But one of the most important things I've learned from that group of healthcare professionals, I think, is this idea of desire and arousal. I think that post-treatment, and when things have changed for you, it's really difficult to reach a point when you feel like you want to have sex again. There is a myth that exists that we, especially as we move through our life course and into menopause, that we should just want to have sex a lot, whereas actually it does change as we get older. Trudy Hannington always explains it a little bit like when you're young, you're a bit like a microwave, and we can just turn on really quickly and get going. And then you sort of move to becoming an oven, and it can take a little bit longer, but you can still, maybe not too long. And then post-menopause, wherever that happens in terms of your age, if it happens earlier than you think because of treatment, but when you're post-menopause, you're a bit more like an Aga, where it can take a really long time to get going. You have to really want to, but you can still cook a good roast. And I do like that idea. So I think there's a lot of the conversation about how we feel about sex and how we feel about sex post-menopause that involves a real psychological element as well.
And of course, if you're Diaga, let's assume you've become Diaga. I mean, what an interesting conversation we've got today. But let's assume you're Diaga and it takes a while. It often comes at a time where perhaps you don't feel so safe in your body, where perhaps you don't feel so confident. So taking your time and doing the eye gazing and, being intimate with one another that isn't just penetrative sex requires time. It requires, you almost need to embark it like a little project.
It does.
And that is often at a time where people are really busy. They might have doctor's appointments, or they don't feel safe, secure, comfortable in their body. So it's a very difficult thing to get your head round. So it's a very head-led thing. I don't know if that resonates with anyone, but I like the idea of Diaga and how you can cook a roast, but it's a very different approach, isn't it, to popping the M&S microwave meal and the job being done.
Yeah, but the meal will be better once you've cooked it.
Yeah.
But the other thing that I think, and again, this might not resonate with everybody, but there is, when you don't want to have sex for whatever reason, there is a real fear of connection with a partner, because if you haven't had sex for a while, there is the risk that if you then make some contact, some cuddling on the sofa or kissing, that your partner then thinks, right, we're off, and it's, and you might then pull away from any intimacy or any connection, because you know that actually sex will be painful, so you don't even go a little bit along the ladder.
Do you know what? A friend explained that to me recently, and she said for the first time was she able to tell her partner, long-term relationship, that she pulled away from a snog because she was worried it would lead on. And her partner was so surprised that she would even say that. And to me as a woman, we've had numerous conversations like that with my friends and other people and women that I know. It's a very normal reaction. You're trying to avoid it, pretend you're asleep, pretend you have a headache. I had loads of conversations like this and experienced it myself. And when she explained that to her partner, it was like he's heard it for the first time. So I do wonder what narratives are out there in the world of people thinking we're going to have the same old sort of maybe sex slave pleasure comfort for all of our lives. That's an illusion, isn't it?
It is. And I think that the best answer to that conundrum, which comes up a lot for a lot of people, in my experience from these sort of workshops and things, is that you have to communicate that with your partner. And actually, I'm going to keep referencing Trudy because she's so fantastic, but she gives couples sort of milestones. So for the first month, you have to reintroduce holding hands, touching legs and on the sofa and kissing. And it is not allowed to go beyond that. So suddenly you can reintroduce intimacy with the absolute safe boundary that you know there isn't going to be any touching of the chest if that's uncomfortable for you, or moving on to any sort of intimacy. And you can then build up the desire, and your partner doesn't necessarily pull back because they're feeling rejection. So the best advice I've heard, and I'm passing it on, secondhand, but the best advice I've heard is the communication around that. And then those, and that's where a third person, when you're looking at psychosexual therapists, can be really helpful, because they can put those boundaries in place for you. They can say, right, I want you to kiss this month every night. And you have to do it. It's one of your pieces of homework, but it cannot go beyond that. So then everybody knows. And then if that feels good, you can move on. And so that it's the building desire again is a project, actually.
Yeah. Guys, I think we need Trudy. Can we
introduce us to Trudy? I will get Trudy
Let's
on.
make that happen, guys. I think we need Trudy.
I mean, you need Trudy.
The eye gazing, the feet rubbing, the shoulder rubbing, and kissing every night. I mean, it's a bit cringe, isn't it? And you're like, oh my God, oh no. It's almost like embarrassing to think, like, it's weird. Like, I don't know, me as a person, maybe it's just me, but like so many things, I'm just like, oh, could I really do that? Like, I think it's so important. And gosh, I need 10 Trudys in my life, if I'm honest with you all.
Once Trudy's told you, you have to do it. You just have to.
And there's someone that feels very much like me, saying totally, this is for me, it's heartbreaking for me and my very understanding but obviously very sexually frustrated husband. So I think for that person, thank you, you've just made me feel a little bit less alone. And someone else is just saying, can we have a GSM workshop for partners sometime? And yes, I think, because I do think some other halves I've spoken to, like, their ideas of what they think is normal out there in the world is not what I hear on a weekly basis. And I'd hate to break it to them all that it's not like jumping under the duvet twice a week until you're 97. But I think they think that's normal. So totally, let's do that workshop.
For so many partners, it's hard to describe that slide of all the possible side effects. That slide. And actually, if we sort of put it in, or if a male was experiencing all of those sort of range of symptoms, then you would completely understand why they would be nervous about reintroducing sex, or whether they wouldn't feel comfortable. And actually, for the man to hear this, or the partner, to hear that this isn't about me, I'm not rejecting you, I'm not in a position, and you then don't have to go through that communication piece of describing all of these, you can let me or Trudy or Dani describe it. And maybe that's really a helpful.
So before we go into products, I do a bit of housekeeping. I've got on my to-do list to get Trudy in. I've got on my to-do list to do a webinar for partners. I might just get that up on YouTube so partners can watch that in their own time without having to sort of join a group. But for anyone navigating sexual health after gynecological cancer, can you go back to episode 127, where Mr. Talaulika and myself share for free everything that we've pulled together in the book, and that is, after which type of gynae cancer can you safely access vaginal estrogen? We've got it all in the book, but obviously that comes at a cost, but it's all in that podcast with him. Obviously there are other considerations to make, but that's interesting. Episode 179 is on vaginal estrogen after breast cancer, which we know can get difficult and confusing, and there are different people doing different things out there. But we've got a great bladder health podcast as well, and that is 182. And if anyone wants to hear about testosterone in particular, it's episode 193. So there's more learning about those medical solutions with our doctors. And now let's talk at lube. My toy, can I just say my toy is still charging? I still can't even turn it on, guys. I'm not the sex education person that you've expected, maybe, or not expected. So let's talk about lube.
Let's talk about lube. And conscious, I've already probably gone over our original plan of how timing was going to go. So
yeah, speed up,
ladies,
Matt.
do keep. Yeah, I'll speed up, but also keep firing in questions as we go. Dani, I'll speed up a bit. So the really important thing with vaginal moisturizers and lubricants is ingredients. So these are the products that we sell and recommend. There are lots of others out there. We'll always answer questions if we can. There aren't lots of good ones out there. So you want to really watch products that, if they don't implicitly say they're pH matched to the vagina, that is a problem. And products that are highly concentrated, we want to avoid. So ingredients such as glycerin, glycols, petrochemical derivatives, estrogen mimics. If you've got any questions, then you can always send them in to us or to Yes. They're really good at answering those questions. And then be guided by what suits you. So if you find a product that is working and that feels good, brilliant. So that, those are the things to remember. A vaginal moisturizer is slightly different to a lubricant. So a vaginal moisturizer is designed for day-to-day comfort. In its best form, so that's the purple one in the bottom corner there. The Yes vaginal moisturizer is made of bioadhesive gums, so gums that sort of adhere to the wall of the vagina, and water, and it is there just to rehydrate the tissue. So that can be used as much as you need daily, twice daily. Daily should be enough, but just to try and restore hydration to the tissues. A lubricant is designed to make sex more comfortable, to make dilator use, vibrator use more comfortable. So to make sex slippy and to try and avoid the high levels of friction that will cause micro tears. So lubricants for sex, moisturizers for day-to-day comfort. The Yes water-based lubricant is a lovely lubricant. It very closely matches natural vaginal secretions. It is pH matched to the vagina. Because it's a water-based lubricant, it does contain, any water-based lubricant will contain a preservative. So, always try it and see if it suits you, but it's very natural ingredients and it's one I really like. And then Olive and Bee is a new product. We've had it about 6 months. It is an oil-based product. It just contains organic grade olive oil, medical grade olive oil, and beeswax. They're the only two ingredients in it. It's a really lovely product to put on the vulva, daily. It's a really long lasting lubricant, and it's a real hero product for me. I've put the Yes Cleanse up there, which is just a foam wash. Just to remind you, we're only talking about very gentle washing or rinsing of the vulva, the external tissue, never internal. If you do want to use something, especially in an area of hard water, which can be hard water can actually be quite abrasive. The Yes Cleanse is quite nice. The vulva dermatologist who sits on our board always just recommends an emollient for her patients, but no harsh soaps, please, no shower gels, nothing that's going to cause irritation. So the work that we've really been focused on in the last few years has been, and this will be a very whistle-stop tour, but has been about the vaginal microbiome. So every area of the body has got its own unique microbiome, which is a group of bacteria, yeasts, that can either be very supportive of health or can negatively impact health. So you may be aware of the gut microbiome, and hopefully you've listened to lots of the menopause and cancer podcasts talking about nutrition and a healthy gut. The vagina has its own unique set of microbes. that can be supportive of gynecological health. What we want to see in the vagina is a type of bacteria called lactobacillus being dominant. So in the gut, we want to see a real variety of species. In the vagina, we want to see this dominance of good bacteria, of lactobacillus. And those lactobacillus, when they are metabolizing, they produce acid as a byproduct, lactic acid, hydrogen peroxide. Sorry, it's turning into a bit of a chemistry lesson, but stick with it. Those acids help prevent bad bacteria joining the party. So prevent the bacteria that will cause things like BV, yeasts that cause thrush, bacteria that are uropathogens, so can cause UTIs, that we don't want to see in the vagina. Unfortunately for us, if estrogen drops off, those lactobacillus numbers really drop off. And that's why we can often see a change at menopause where you might experience more UTIs, you might get recurrent BV, you might get recurrent thrush. And it's often linked to this depletion of these good bacteria. So we understand that. We now manufacture 2 products that are food supplements that are taken orally. These just contain the vaginal lactobacillus that you want to see in a healthy vagina. Got lots of evidence to show that they reach the vagina alive and can help restore that natural protective role of the lactobacillus in the vagina. It's really important to say at this point, and I'm sure any supplements that you consider, you would always talk to your healthcare provider about. Specifically with any live supplements, live bacterial supplements, you must not take live bacterial supplements if you're immunocompromised or you're on active immunosuppressive treatment. But fine to take after your active treatment. Another episode to write down, but episode 159 of the Menopause and Cancer podcast, Joe Bailey, who's a gynecologist from Bristol, is specifically talking in much more detail about the vaginal microbiome, understanding the changes that might happen post-treatment and post-menopause. And so that's a really, really great conversation to catch up with. I love to include this, but Darlene is a fantastic ambassador for us. But Darlene had lobular breast cancer in 2016. She's a sexual health nurse and really, really struggled with chronic BV post-treatment. And she decided to do her own little study. She was trying all sorts of different products and lubricants and moisturizers. And then we met and she started taking Ultimate V, and you can see she did slides for us to show. But these slides, this was week 1, where you can see this is there are no bacteria present in week 1, and then if we look forward to week 4, those little purpley blue dots are all healthy lactobacillus, and you can see how the tissues changed over week 4, and it really, her symptoms went from struggling to sit down to really improve within 4 weeks. So lovely little story, positive story, I think, to go alongside that.
Eleanor, I just wanted to come in because that episode with Dr. Joe Bailey was really interesting, because they're doing research in Bristol as well on the microbiome, introducing probiotics for the microbiome. And that's very new, isn't it? And so a lot of sexual health therapists, a lot of menopause specialists, oncologists, or all of them together are like, let's watch this space, right? So we need more evidence, we need more research and larger scale trials, but it seems to be something very hopeful, something really positive to add to our toolbox. You've been there for a long time now, so for you it doesn't feel like anything new, but like we've had chats about sexual health for years now, and with Joe it was really the first time that was sort of put on my radar, and it kind of like makes sense, right? So people talk about the microbiome in your gut, and I've been one of those people who jumped on the opportunity when I was gifted to do my Zoe testing years ago when they brought it to the UK, and I wanted to know how good is my microbiome in my tummy. was there much point in eating all of these lovely sauerkrauts and fermented foods? And I just wanted to know what's going on. But of course, the microbiome in our vagina has the same impact on our vaginal health than the
Yeah.
microbiome in our intestines has on our overall health, right? It makes sense.
Yes. So it is the most exciting thing I think that's happened in women's health, is this understanding of the power that how across women's health, outside of menopause, we're starting to understand infertility and in inflammatory conditions and in these chronic infective conditions, that we're starting to think, actually, we've been treating this all wrong. We've been treating these areas almost like they're sterile and putting women on antibiotics.
Yeah.
But this isn't like having BV isn't like an acute lung infection. These aren't sterile areas. And I sometimes like to use the analogy. So we've got some really exciting things happening this year. We're on an advisory panel, a global microbiome advisory panel, but looking at how we integrate microbiome-led care into all pathways in women's health. But something that I like to, when I'm sort of trying to explain it at a dinner party sort of conversation, if you imagine a flower bed, and in a vagina, what you want to see is a roses. So you want to see dominance of certain types of flowers. So you might want to see lots of roses, few species of roses in there. And then we've been looking at that flower bed and we see one stinging nettle pop up. And what we do is we spray the whole flower bed with weed killer, which is our antibiotic. And then next week, you've got nothing in your flower bed. 2 weeks later, all you've got is stinging nettles. Rather than nudging ourselves back towards this healthy environment where you've got these dominance of good bacteria. So it's a really, it's an exciting area of health. And very specifically, when we're talking about hormone-led changes, it's really nice to start thinking about alternatives that aren't hormones. So it feels really exciting. Yeah.
Thank you.
So vaginal dilators, you may have come across vaginal dilators. You may have been prescribed some vaginal dilators. There are a couple of things I wanted to mention. We sell sole source vaginal dilators. They're super soft. They're very flexible. They're silicone. So if you've only seen plastic dilators and you're horrified by the thought of them, these are very different to the plastic ones that you get. Dilators are, if you haven't come across them at all,
these are not very flexible.
Yeah.
Mine are silicone ones.
Yeah.
They come in different sizes. It's a little set. There is different sizes.
Yeah.
That's the smallest size. But even that smallest size, that doesn't bend at all.
Yeah.
This has nothing on it. So do they come in different sort of textures?
Yeah, they do. So I wanted to have a really flexible, because they're much more comfortable, and these dilators start really small. So this is the size of my little finger. So
wow. So this set has it's quite different.
Yeah.
That's actually not that small as the smallest size.
No. And these, they can be bought individually or they can be bought in sets of 4. So a very popular set is just the small set, which is just these 4, for example. So then, you can jump in where appropriate size-wise. These do go up pretty big, but not everyone needs to go there. And some people do, if you're working towards if the goal is to have sex with a partner who is, quite large, that it's having the confidence to know that that's not going to be painful. You might want to work up to the bigger sizes.
Eleanor, someone is just saying, I use the ones Eleanor has and they are fab. The ones the hospital provide are barbaric. Laugh out loud.
Yes. Laugh unless we're crying. I mean, that's the thing, isn't it? I mean, it's so many people who come to us, they have been given a set of plastic dilators with no instructions, no understanding of why you would need them or when you would use them or how you would use them. And they sit in a drawer or in the bin. But I believe there's a really good place for dilators if used use sensibly. So there are two reasons to use dilators. One is to try and prevent that shrinking of tissue, that atrophy, that scar tissue formation. So to maintain the space. So that's one reason. There is also, when we think about the pelvis, this basket of muscles, the pelvic floor muscles, which line the whole of the pelvis all the way from the pubic bone at the front round to the coccyx at the back. Those pelvic floor muscles have a really important function in continence, bladder and bowel continence. They're really important for sex. They're important for stability, but they're important for mobility as well. So they're like an orchestra of muscles that need to turn on and switch off at the right moments. When there's a painful stimulus anywhere in the body, muscles go into a protective spasm. So if you've got a sore shoulder, your neck could feel, oh my God, I can't, all muscles of your shoulder will sort of go into spasm. If sex is painful, or if everyday activity is painful because you've experienced some of those changes we were talking about, your pelvic floor muscles on top of that can then go into a very protective spasm, which can mean sex. So you might have heard of a term, say vaginismus. It can be really, really painful then to think about having sex. On top of those changes to the tissues, we've also got a protective spasm from the muscles. And that's another reason dilators can be really helpful. You can retrain the body to understand that penetration isn't going to be painful. So you start, when you're using them in that way, you start with the smallest dilator, loads of lubricant, lots of time, not going to be interrupted. Don't do it just before you go on a school run. And you start with the smallest dilator, you gently insert it, do your belly breathing, do your deep breathing, and try and allow that pelvic floor to relax. You can move it around slightly, leave it in situ for a few minutes. And you can retrain the mind to know that stimulus isn't going to be painful. And then you slowly work up through the grades. So that's a way to do some muscle retraining with dilators. So you've got this dual effect. It's about tissue, preventing of scar tissue and trying to prevent that sort of constricture that happens through the atrophy, but also the benefits of down training that muscle if the muscle spasming is causing a problem. Does that make sense?
Yeah, that's such a great explanation, because I didn't know any of that really. And someone said they were given a dilator straight after her treatment, radiotherapy, internal radiotherapy treatment. And she was told by the radiotherapy nurse, use it or lose it. And that was it. No other advice than use them for a year. And actually, I was going to say to you, could you turn the slides off for a moment? Because I think if, just so our pictures are a bit bigger for people at home, because if anyone was going to get dilators, and it doesn't matter where, if you go on Amazon or wherever you go, can you hold yours up? I just wanted to show people that maybe you need to. Yeah. So can you see how mine are on loops, for example? And that's the smallest, and then they don't bend. So you might have to look at the measurements. Sorry to be this detailed, but you might have to actually look at the measurements of each one of them and kind of like work out what is the smallest from the set you're going to get, because they do all come, they seem to be quite different. I mean, they look similar, but actually it hadn't occurred to me that maybe the smallest size isn't your smallest size. Yeah.
And then the other thing to remember is, depending on when you start to understand the different ways they can be used and the different benefits, if you're you're having internal radiotherapy and you are just wanting to maintain a certain size, it's comfortable, you haven't got that pelvic floor reaction, we sell them individually, because some people just need to jump in at a size 3, or you don't need to do the graded dilation. You just need to use a dilator, a comfortable dilator, and use it regularly.
These have numbers. Have yours got numbers on them?
No.
Why would they have numbers? Is how high you can penetrate?
Yeah, so it might be to try, if you're trying to monitor progression, to see if so sometimes if you're worried, or is there change, so that can be sometimes quite helpful, and then other times sets are useful. So but we sell a small set, because it's sometimes quite intimidating to see the big one, and you might not need to use the big one. So there's lots of different things to consider, but look at the sizes, compare across different websites, or there's lots of different.
Yeah.
Next thing I wanted to talk about, and I know you've got some things plugged in, is vibrators. So vibrators are really useful to improve blood flow to an area, to try and reintroduce pleasure, for self-pleasure, to introduce with a partner. Some of you maybe have your own stash that you used before, get them out of the cupboard, dust them off. If you haven't ever considered using a vibrator and it's something that feels a bit intimidating, I would say there is a real therapeutic benefit to vibration. So if it hasn't been something you've considered before, now's a really good time to think about it. So it's really good for pelvic floor relaxation. So there's lots of good reasons to think about vibration as a therapeutic tool. We designed a couple of vibrators, but there are lots out there and lots that Dani can pick up and show. These are the Cato vibrators. This was our first vibrator. I wanted an external vibrator because it removes it's nice to have something where you don't have to go to penetration. So that was something super soft, a really, really nice flat surface. So for lots of external massage when we're thinking about blood flow to the vulva, blood flow, relaxation of those muscles. So a lot of our physiotherapists really like this as a sort of massage and relaxation tool. It's waterproof, USB charger, and it's got a really discreet button that you can just cycle through. We get amazing feedback, but we also get, for some people, even all of the cycles I find too sensitive, and other people saying I've lost a lot of sensitivity and it's not enough. So there is a little bit of trial and error finding the right tool for you.
With this thing, what vibrates or what buzzes? The whole thing?
The whole thing, which is actually really nice. So it's a little bit more you cycle through different cycles, but it's a little bit more concentrated at that sort of teardrop end, but it's a little bit more rumbly and diffuse at the other end. So you have got the benefits of both. But there are, your body will have changed as a result of certain treatments. So finding the right thing might be some exciting trial and error.
Yeah.
That's how I like to think of it.
Those sort of vibrators that are silicone, do they have a shelf life? Like, can they go off? Like if someone was going to dust one off from their drawer and it's been sat in there for a long time?
I mean, no, there is a degree of porosity to them. So being able to clean them really well, especially when we're talking about not wanting to introduce any bacteria. So if it's been really dusty, you'll probably find the battery's not working anyway at that point. So the battery will have a shelf life. But yes, probably for hygiene. If we're talking early 80s, I would say maybe think about reinvesting.
Yeah. And I'm really conscious of time, but I need to ask you a couple more questions. I know. Yeah. So this thing, what would this do then? So this is...
Yeah,
I don't know. It's called a womanizer, which is the weirdest name, but it's obviously got a suction thing here.
So a clitoral suction device. Yeah. So that we often hand people over to recommend Joe Devine, the Shush store. They've got some really good. We're almost a starting point if you want to think about introducing vibration. Yeah. Then there is some really good sexual sex toy websites.
Yeah.
That have got much wider ranges, and you can really start to explore some other options.
Yeah. Yeah. And then this is obviously a little bullet that is much smaller than the dilators.
It's really nice and really nice to consider as an alternative to a dilator.
Yeah. Fits in your handbag.
Fits in your handbag. If it's the right size.
I'm joking. It's not the sort of thing.
If it's the right size, you can use that instead of a dilator.
Oh, yeah.
So that's nice. Then we've got a very flexible internal vibrator, Cato C. So that's nice. So explore, try them. That's that.
Yeah.
Sorry, very conscious of everyone's lunch break.
I know. What's this? Oh,
Donuts.
you must talk about that. Yeah, yeah.
So if deep penetration is a problem, so if you've got a shortened vagina post-hysterectomy or because of atrophy, ONUT is a set of silicon stacking rings. They sit at the base of the penis or base of the dilator, and they help control penetration depth. So you can stack them up. You get 4 in a set. You can stack them up as many as you like. They sit on the penis, and then it's a really comfortable buffer, essentially shortens the length of the penis or the dilator to stop sex reaching the point of pain, which means everybody can relax and then you don't get that pelvic floor involvement. So a really brilliant tool if deep, so it's, we're not talking about that entry pain, we're talking about if deep penetration is causing anxiety or pain. This is
the toy
really,
you need.
yeah, yes. This is your toy. Super flexible, so one size fits all.
So much food for thought outside of the medical advice that needs to be prescribed for us. And some people may try all of this and need medical advice and still may experience discomfort. And some people may add something to their toolbox, maybe like I don't know, looking at their microbiome. And that might be the worst is that if you haven't got another option in your toolkit, isn't it? So I hope something in today's conversation just sparked another sort of window of opportunity for someone else to help them with their symptoms, their comfort, their pleasure. We've got a lot of things on our to-do list now, Eleanor.
Have we got, it's only, I know I talked and talked, I'm sorry. Have we got any more questions, or was there anything else that?
Someone said, thank you so much, so helpful, much more informative than anyone at the hospital. Oh, that is lovely. Lots of hearts flying around. It's been such a brilliant session. Thank you so very much. We are going to do our best to link. I'm going to link to you and some products in the show notes if people want to go and start to do their research. And everyone is very welcome to join Eleanor and myself on our next walk. So you can talk about sex and intimacy for 12 and a half hours.
Amazing what you can cover over 50 kilometers. That is going to keep us going.
Someone said, fantastic. Thank you for all the suggestions. Thank you all. So lots of love coming in for your way. Lots of love hearts as well. Thank you so much.
Thank you.
I really hope you found today's conversation super practical. We had great feedback from so many people on the call. And my sex toys here still haven't charged fully, but I'm going to put everything that I got out back in its boxes. And maybe whenever I'm ready, I am going to explore a little bit more, as probably all of you will digest the information of today's podcast episode in your own time, and you will take with you what you need and what you need to research a little bit more about. And with that, all the best in your research, in everything you do, in trying to navigate menopause after cancer. I hope today has been helpful, practical, and I can't wait to see you on the next episode.